I'm Anthony, and welcome back to the channel. And what I want to talk about today is the biceps tendinosis. And so here's the thing. If you've had biceps tendon surgery, then you know what this is about, right? So you're in the second week of recovery. I'm almost to the third week. And I'm going to walk you through some essential exercises that they told me how to do. I'm not a physical therapist. That's not why I'm doing this. I'm just trying to show the average person who's had this done what to expect if you want to get better from it. So one of the things they show you is, I'm going to start with this pulley over the door. And because I've had this issue before, this is what it is. It's an over-the-door pulley that you can actually sit in a chair and do it. So I've been dealing with this thing for years, so it's not new for me. But anyway, it may be new for you. So, in order to get some of this moving, because I've had, let me just show you this again. I've had my surgery right here. You can see that. It's healing nicely and it's forming a nice scar. So, but you know what? It still hurts. It's not perfect, but I'm icing, I'm heating, I'm doing what I need to do, wearing the sling when I need to. I don't wear it all day because I don't need it all day. So, it's very easy. You can get these for $10 on Amazon. I've seen them. And I think I got this one from a physical therapist. But, so basically it's just sitting here with the back against the door or back against the chair and there's a lot of ways you can do this, but it's not really how many times you do it. You can do it 10, 20, whatever you want to do, whatever feels right. If it's too much, like I don't pull it all the way because it's still tender in there and sore. So, you can do it to your own level. Now this one is still sore because it never really healed on the right side either because I haven't had it done yet. But now that I've had the left side done, I know what it will feel like, so I'm not afraid to get it done. Because I know it needs the same kind of work, maybe more, maybe less, I don't know. But that's what we're doing. So you do this for a couple minutes till it feels good. You don't overdo it. And then on to the next thing. So there's a couple things. They don't have you doing a lot. So one of the other things is just doing a stand. You can do this standing or sitting also. I'm going to just bring this a little closer so you can kind of see what I'm doing from the side here. So basically, these are shoulder squeezes. So you keep your hands on your feet, or on your knees, right? Keep your hands on your knees, on your legs, and you just pull back. So you squeeze the shoulders back to what's comfortable, get a nice squeeze between the shoulder blades, and relax. And I can feel everything squeezing back, 4, 5, and relax. 1, 2, 3, 4, 5, and relax. And I do about 2 sets of 10 on that. So there's that. Then I have, let's see, where's my other ones? Over the door pulley and the shoulder blade squeezes. The other thing is the pendulum squeezes, or the pendulum swings. Okay, so those are where you're just allowing your arm to swing, right? So those are pretty easy also. Come back, come back. I'm just going to pull this up a little bit so you can see. And I'm going to step over here a minute and grab my little stool. Actually, I think I'm going to grab the chair for this because it'll be easier. So this one you just kind of lean forward and let me see if I can get this down a little bit further since I'm going to be, yeah, like this. All right, I can see it now. So you're just kind of swinging your arm back and forth, back and forth. And you're kind of moving your knees back and forth and letting the arm swing. This is called pendulum. And you can kind of let it go in a circle because you're letting the weight of your arm take it down, right? And this is very good. This is what they show you to do in physical therapy. I'm not showing you anything different than they would show you. If it hurts, don't do it. Make sure you go to your physical therapist and ask them if it's okay to do it. The other thing is called a hand slide. And this is something we're going to do over here. I'm going to show you how to do this on a flat surface. Now it's really good if you have a place like a table to do this on, massage table, a kitchen table, whatever table you have to do it on, okay? So we're just gonna bring the arms out and up. And you can do this with both arms. That hurts a little bit. Going forward, you know, just letting your hands lay forward. Getting a good stretch in there is what you want. Not to overdo, just to get enough there so that you can feel that. Just turning this just a little bit so you can see what I'm doing here. And it's all up in here is where I'm stretching that. I'm just doing a nice slide back and forth. And that helps with stretching that out. And you can do both. You can do both arms, one arm. And really, that's about it so far that they've showed me. They don't want me to do too much more. So I'm not. I'm only doing basically what they showed. And just some things to get moving, you know, because none of this is going to fix itself. You're going to have to do it. That's how body work of any kind works, even if they're repairing. Actually, what I'm also wearing right now is my Alpha Stim. You know, because a lot of people don't know about this, but this is a little device that I found out about when I worked at the VA. And nobody really wants to tell you about these things, but there's lots of good things out there. And actually, Medicare pays for it. I want people to know that if you have Advantage Medicare, it will pay for it. So it's about a $3,000 item, but if you go to Medicare, get it through your Medicare provider, have your doctor order it for you if you have anxiety, depression, it does wonders for that. And I've helped other people get it at the VA. They get it for free, actually, if you're a vet. So if you are, take advantage of it. All right, people, thank you for listening. Have a great day. There will be more about anxiety, depression, how to relax with it, how to breathe deeply, how to let go, and how to take care of yourself through any time that's distressful in your life. Thanks for listening. This has been A Few Minutes with Anthony at Healy Teach. Bye-bye.